Choosing the right doctor is one of the most important decisions that you can make for your health. Now, whether you're looking for a primary care physician or a specialist, there are strategies to guide your search.
And that's what we're talking about today with Dr. Brandon Bentley. He's with the Department of Family and Community Medicine with Wellstar MCG Health. And with him today is student Dr. Michael McGrath to discuss how to find the right doctor or physician for you. Guys, welcome.
Good morning. Thanks for having us. Good morning.
Of course. Well, Dr. Bentley, what are some key factors to consider when choosing a primary care doctor?
Yeah, so one of the big factors is proximity.
Right.
Because if that physician and that provider aren't close by, you're probably not going to go. So you want to make sure that you're finding someone who is a level of convenience to either home or work, where are the two places that you're going to be more so often. So that way you can actually make those appointments. You want to talk to those physicians about their hours. You want to talk to them about maybe their prescribing habits and make sure that that conversation is early on. Let them know about any family history. And then if you know that you have something that's going on with yourself, make sure that you talk to the physicians about it so that they have some knowledge. You want to be with the physician who is best able to direct you for that care. Because unfortunately, if you talk to someone, and this is why we really encourage these conversations early, if they might not have experience treating what you might have within your own past medical history, then maybe that isn't going to be the right therapeutic relationship for you, and that is okay, and we can find another physician for you.
Okay, and Dr. McGrath, let's talk to us about the resources that are available. What do we have out there that can help us find a physician?
There are a variety of avenues that exist. There are some employers and some universities that'll keep lists of local primary care providers who often work with their employees or students. There are community programs, perhaps through health departments and nonprofit clinics, that can help point you in the right direction, particularly of use for those who may be underinsured or uninsured. And then one of the most accessible things we have is a search within your local health system or your local hospital. Their website will often have built-in features, for example, Wellstar MCG. We have a Find a World-Class Physician tool as it's advertised, where you can filter based off of specialty, in this case primary care, gender, as well as languages.
Very good to know. Well, how can patients determine if a physician is in their network?
One of the most useful things you can do is directly contact your insurance provider. Our hope is that there's someone on the other end of that phone who's going to be excited to help you find who is in network. But if for any reason you experience difficulty with that, you can look on their website. Oftentimes, too, on the back of insurance IDs, they'll have a website that you can go to with very useful Find a Doctor tools. And then in addition to that, contacting the office or clinic directly just to confirm and touch base, perhaps provide your ID number with your insurance and confirm that you'll be covered and that your plan is accepted there is of great use.
Dr. Bentley, you mentioned a good fit just a second ago.
Yeah.
What are some important questions that you need to ask that PCP in case to make sure that that's a good fit?
Yeah, so one avenue, especially as we get more and more technologically based, is availability, and that includes telehealth opportunities. If they have the ability to do these video visits, how that works, if there are any after hours type visit times. So if there's going to be something with late afternoons, early mornings, or even weekend hours, because we recognize that everyone has a job, right, and those 9 to 5 hours might not work for getting into a physician if you can't get out of work. So talking to that office and seeing what other options that they have out there, talking to the physician, and then understanding, something that I practice myself is if we're right on the borderline where we can talk about lifestyle options or medication options, are we going to have that opportunity to see if we can develop some lifestyle interventions so that we don't necessarily have to go to medications, and then making sure that we're on the same page about overall health and what we need to do to keep ourselves healthy for preventative care and for maintenance care as well. So early conversations with the physician before you're sick. That way you can know that you can rely upon that physician if you do unfortunately come down with something. Then of course, if that office has other physicians that you might be seeing in case the doctor that you normally see is unavailable, so that you can still be seen in a timely manner.
Good stuff to keep in mind right there.
Yeah, I need one.
I've got one, and I'll tell you what, when you find one, you keep that
Yes.
particular physician.
Yeah.
Forever,
The
right?
one that I've had, yeah, for 20 years.
Yeah, that therapeutic relationship is so important. Knowing the patient and being able to work with them
Right.
is very, very important.
All right, good to know.
Great resources to have here to find your own personal physician. Gentlemen, we appreciate you joining us.
Thank you.
Thanks for having us.